Welcome everyone to the STEM Talk, session 21 of the 7th Polygen Symposium of Rising Scholars. My name is Angi and I will be moderating today's session. The goal of the symposium is to celebrate and showcase the hard work of our Polygen scholars, all of whom have tirelessly worked on their projects over the past couple of months. We have 5 students presenting on a variety of topics today. A fellow member of the Polygens team will be scoring each student presentation, which will help us determine prize winners after the event. Please type your questions in the Q&A if you have any for the speakers. We will have time at the end of the session for the speakers to answer those questions. Today's speakers are Angel Shi, Rishabh Hariharan, Neetika Mishra, Rhea Acholkar, and Vincent Nguyen. Let's jump in and hear Angel's presentation first.
Can everyone see the screen? Okay. Hi, I'm Angel Shi, and today I'll be presenting on the driving question of how is language learned, processed, and used across different species, and what are some ways to facilitate cross-species communication. This is the table of contents of things I'll be going over today. I'll first start with a brief background on communication, then section 1 and 2 will address how is language used, processed, and learned, and then I'll go over ways to facilitate interspecies communication and ending with future directions. Communication is any interactions between two species that cause a change in behavior. Interspecies communication is any communication between two animals of different species. The challenge in this field is that humans are historically used as the standard, meaning the most intelligent animal with the most sophisticated communication or language. However, each animal has its own unique behavior that's adapted to its unique environment, which makes this a challenge because first, it's difficult to compare apples and oranges, and second, animals that behave very differently from humans are not well studied, which leads to a gap in knowledge of only certain animals are well studied. So why is any of this important? Well, with the understanding of how animals use, learn, and process language, it will help with, first, finding ways to facilitate interspecies communication. Because communication is a bridge to cooperation, if there were a way to communicate with other species, then there's a way to cooperate with them to solve global issues. Moreover, if humans can communicate with other animals, then humans can better understand their needs, which will help improve animal welfare. Also, having this background knowledge could improve our understanding of the evolution of language with applications in AI. A side note on methods, this project focuses on the concept of language that's not unique to humans, with a focus on vertebrates, including humans. The information is obtained from scientific articles. There's 2 ways to go about communication. There's innate communication and learned communication. Innate communication is shown in fish and humans as well. Although humans mostly thought to have learned communication, humans actually have innate communication such as crying, screaming, and laughter that could be traced down the polygenetic tree to other non-human primates such as gorillas. And innate communication in birds and rodents are mostly thought to be linked to activities in the brainstem. Vocal learning is a way to acquire learned communication. It could be separated out to vocal production learning, contextual learning, vocal comprehension learning, and vocal usage learning. It is thought to be a behavior unique to only human and a handful of other animals. However, recent studies show other animals such as mice, goats, and monkeys have vocal learning as well, which can be proved by the continuum hypothesis proposed by Rhea and college, which separates vocal learners into long learner, limited vocal learner, moderate vocal learner, complex vocal learner, and high vocal learner. Social reinforcement learning is adjusting appropriate responses based on the reactions of others through positive or negative reinforcement. And this type of learning is very important for learned communications. In marmoset monkeys, they show FOXP2 expression in the cortical striatal circuit, which proves that they have social reinforcement learning. And this is thought to arise from cooperative breeding. In zebra finches, female feedback on immature male song had led to better song because the dopamine system or the brain's reward system is connected to VTA and area X. Both are related to the song system in the brain, and that shows vocal reinforcement learning rewards, how it works. And hormones such as arginine and vasopressin also have a role in social reinforcement learning. In greater sanguine bats, pub-directed vocalizations are another form of social reinforcement learning. It is group-specific, which could be where dialects come from, and parents will adjust call based on pub's vocalizations, which is where social reinforcement learning will come into play. The evolution of communication-related structures is thought to be a convergent evolution, and there's two steps. First, physical vocal pathways need to evolve, then comes vocal learning and learned communications. And it could be explained by two previous hypotheses. The social complexity hypothesis proposed by Todd Fieber's study in Caroline chickadees, and the social brain hypothesis proposed by Robin Dunbar. So without that information, what are some ways to facilitate interspecies communication? First, there are many examples of interspecies communication in nature, in animals with symbiotic relationship. As shown here, the eastern gray squirrel is eavesdropping the American robin to alarm calls to infer safety. And here are some previous examples of human attempts to communicate with other animals. For example, the clever Hans phenomenon, where clever Hans is thought to learn math and also human language. However, he was guessing the answers based on social clues and not what other people thought he was doing. However, other studies that followed clever Hans were more successful because they incorporated the model rival learning, where the material is made more feasible and beneficial to the learner, therefore easier to learn. And some example includes Coco the gorilla, Alex the parrot, and Kenzie the bonobo. A recent technology attempt to cooperate with other non-human animals. It's the brain-brain interface, which allows human brain to directly control another animal's behavior. However, in this type of technology, there's no communication between human and the animal. Therefore, a better way of cooperation is needed. And some other examples of interspecies communication includes the cat's meow, which is similar to the Neetika sign language phenomenon, because cats actually invented meows to communicate with humans. They don't meow to each other, which shows that they have an innate urge to communicate with others. And this urge is not unique to humans. In dogs, they can understand human emotions through chemosignals, which are any chemicals produced by the body, such as odor, sweat. And my proposal for ways to facilitate interspecies communication, including first, establishing a symbiotic relationship, because that's where interspecies communication arises, and then finding or establishing specific sensors for detecting chemosignals, which is one of the most ancient form of communication that many animals have. And also inventing interspecies gestures, because even in fish who thought to mostly have innate communication, they can learn and perform tricks, which could be a way of communicating through gestures. Therefore, gesture could serve as a middle ground between different species. Some future directions include studies in bacteria, virus, fungus, microbe, interspecies communication, and plant-animal interactions, which is a cross-kingdom interspecies communication. Virus is actually thought to have some intelligence as well, such as the SARS-CoV virus, which raises the question of, is language the equivalence of brain and intelligence? What is even the definition of intelligence? And whether or not human can communicate with bacteria through chemical signals. That's all. Thank you. Please let me know if you have any questions. And big thank you to my mentor, Sarah Hacks, for the countless support, and apologies for offering a wonderful platform.
Thank you, Angel, for that great presentation. Let's continue with Rishabh's presentation now.
Can you see my screen?
Yes.
Okay. Okay, my presentation is on cannabinoids and epilepsy. So first of all, we're just going to talk about epilepsy in general, and then we're going to talk about current treatment that is present for epilepsy, and then we're going to talk about alternatives, and we'll conclude. Okay, so our research question is, in adult epilepsy patients diagnosed with epilepsy, how does the use of CBD impact seizure activity and side effects when compared to patients not using CBD? So we use many reliable sources like PubMed and others to collect data from studies that were conducted from different scientists in the field of neuroscience, and my sources can be accessed in this link. So let's talk about really what is epilepsy first. So there's two major types of epilepsy. There's generalized epilepsy, and then there's focal epilepsy. So generalized is essentially where the neuronal excitement is everywhere in the brain, and focal is where it's in one area of the brain. But focal seizures can eventually become generalized seizures when they spread to different parts of the brain. So the general archetype of a seizure that everybody thinks about is the convulsions and loss of consciousness, which is actually called a grand mal seizure, which is also known as a tonic-clonic seizure. And this is a generalized seizure. So overall, a seizure is essentially just periods of neuronal excitement, and that can actually, and it's present in children and adults most commonly. And you can see in this image here, the change in amplitude of the waves in the electroencephalogram when the seizure actually begins. And that's just that how they characterize neuronal excitement. Okay. So in order to talk about, we have to talk about how it begins. So in the body, there's something called GABA, which is a neurotransmitter that maintains levels of neuronal excitement. Okay, so GABA is a signaling molecule that travels through the body through paracrine pathways. So this basically just means that signals are transmitted from cell to cell in short distances. Okay, and all signaling molecules eventually bind to the receptor protein, which in this case is the GABA A receptor. Okay, so, and the GABA A receptor plays a role in the central nervous system. Okay, so once the GABA binds to this receptor, there are chloride ions that actually fire through this protein channel, which then make sure that action potentials don't fire. Okay, and action potentials are essentially neurons firing in your brain. So that's how GABA basically inhibits the firing of neuronal excitement. So let's say, for example, somebody does not have enough GABA, then that neuronal excitement cannot be maintained, and it'll lead to periods of increased neuronal excitement, which can then lead to a seizure. Okay, so if the problem we assess starts with neurotransmitters, the fix also lies there. So AEDs, also known as anti-epileptic drugs, are the main mechanism in treating epilepsy, and they use these GABA pathways in order to inhibit seizures. Okay, so there's an enzyme called GABA transaminase, which catalyzes reactions to get rid of GABA in the body when it's not being used. So let's say the body's at homeostasis and the neurons are firing normally, then excess GABA won't need to be produced, and this transaminase can come and basically get rid of that GABA. Okay, but what AEDs do is they actually stop this enzyme from binding with its substrate, and they just maximize the production of GABA, and they essentially create a reservoir in the body of GABA that can maintain that steady level of neural excitement. So why is epilepsy such a big problem? It's estimated that 3.4 million people nationwide suffer from epilepsy, and this breakdown consists of 3 million adults and 470,000 kids. And it's actually interesting because it's the FDA approved a drug in children modes for countering epilepsy, but they haven't approved any in adults, which is still interesting because more adults actually suffer from epilepsy than children. And some of the big problems that they can risk in permanent brain damage, psychological problems like schizophrenia and depression, and overall just the degraded quality of life. Okay, so AEDs, through many studies, have been proved to be very effective against seizures. But their biggest problem, and most of them use that GABA pathway that we talked about earlier. But the biggest problem is that they come with a lot of adverse events or side effects. And it's also estimated that 20 to 40% of epilepsy patients are resistant to AEDs. Okay, so now looking at the data that I analyzed from studies that were conducted by other scientists. So there's 18 studies in total, and their way of measuring how good CBD is they measured the efficacy and the safety of CBD in the treatment of epilepsy. So there's 3 major clinical groups, 6 out of them being adjunctive treatment groups. So 3 out of 5 of the placebo-controlled trials were also adjunctive treatment. And adjunctive treatment just essentially means they were taking CBD and AEDs at the same time. And then the biggest group was just lone CBD treatment against epilepsy. Okay, so first let's look at lone CBD treatment. A lot of the studies use the seizure intensity scale, which is a scale from 1 to 100 that basically just assesses the intensity of people's seizures at the beginning of the trial and at the end. So it was recorded that there was an average decline in 45.2 points in this scale, and also that there was a 45.8% median monthly reduction rate when people were just using lone CBD treatment. Okay, then now let's look at placebo-controlled, and this is not including adjunctive treatment. So these same types of trends that were observed in your lone CBD treatment group were also observed, as we saw a 62.1% average decline in seizures, and overall 40 patients total became seizure-free. Okay. Now this is adjunctive trials combined placebo group and the non-placebo group, so 6 trials. So because it's an adjunctive trial, we can actually assess the difference between the efficacy of AED groups and the efficacy of CBD groups. So we can compare them together because one group was just using AEDs while another one was using AEDs and CBD. Okay, so in the AED groups, they recorded around a 30% reduction in epilepsy. And in the adjunctive treatment group, it was a 51.1% median reduction. And 63% of patients had reduction rates over 50%. So there's a really big margin between the efficacy of AED and adjunctive treatment. So this provides a very interesting outcome. Okay, so now let's go into safety. So only 4 out of the 10 studies that were assessing lone CBD treatment were able to comment on the safety profile of CBD. However, all of them, even though all of them did report the side effects and the percentage of patients who did experience side effects, only 4 out of 10 were able to comment on the differences of safety profile, which means they're assessing the difference in safety between CBD and AEDs. Okay, so 4 of them were able to do this. 2 out of the 4 reported that AEDs were better than CBD in terms of safety profile, and the other 2 did not say that. They said the other way around. Okay, so they're basically, we can't really make much of an assumption from this because a lot of the studies didn't really report much. Okay, and the most important is the safety of adjunctive treatment, which we covered the efficacy of in the last slide, which proved to be really convincing. And the overall conclusion is just that the percentage of patients who experience adverse events was much more in adjunctive treatment groups compared to AED treatment groups. So we can say that this AED treatment is much superior compared to adjunctive treatment, but that efficacy has to be considered before we completely eliminate adjunctive treatment as a potential treatment alternative. Okay, and now on to the conclusions. So the safety profile of CBD is essentially on par with AEDs. The percentage of patients experiencing common side effects like nausea, fatigue, and diarrhea was found to be nearly identical across the majority of the included studies. Some studies reported a modest benefit to AEDs when compared to CBDs in terms of safety profile, but the effects were overall marginal. And the same can be said about adjunctive treatment, CBD treatment, as a percentage of side effects observed in patients using adjunctive treatment greatly surpasses the side effects as a result of AED treatment. So the information drawn from the studies provides an interesting perspective regarding validity of CBD as a treatment, and patients often look to an alternative therapies as a response to that high percentage of adverse events that we see in the AED treatment. And it can overall be concluded that efficacy of lone CBD and adjunctive CBD treatment is better than the efficacy of AEDs. However, you can't make any assumptions between adjunctive treatment and lone CBD treatment because no studies have really been doing experimental design like that. So I'd like to say thank you to my mentor, Michael, and to Pelagians for giving me this opportunity. And thank you.
Thank you for that great presentation, Rishabh. Now let's continue with Neetika, but I'd like to note that at the end of all 5 sessions, all 5 presentations, we'll have some time for questions from the audience members. So Neetika, if you're ready, let's jump in.
Can everyone see this?
Yes.
Okay. So, hi everyone, my name is Neetika Mishra, and I will be presenting my research this summer on spinal muscular atrophy. I will be discussing neurodegeneration, spinal muscular atrophy in general, types and symptoms of SMA, the genetic basis of spinal muscular atrophy, and the functionality of the specific protein that causes spinal muscular atrophy, and gene therapy and future treatments in the end. But let's start with the basics. Neurodegenerative disease is an umbrella term for conditions in which there's a loss of functionality of neurons. This includes Alzheimer's, Parkinson's, and multiple sclerosis, but also spinal muscular atrophy. According to the Cleveland Clinic, around 10,000 to 25,000 children in the United States suffer from this rare disease. Spinal muscular atrophy is an autosomal recessive disorder and is caused by a mutation in the survival motor neuron gene. The survival motor neuron gene, or SMN1 as I'll refer to it, is responsible for creating a protein that is essential to survival of motor neuron genes. For motor neurons. And the defect in this gene causes motor neurons to begin to die. And general symptoms of SMA just include loss of motor skills, proximal muscle weakness, and other different types of symptoms. However, there are 5 main classifications of SMA. SMA is basically classified based on highest physical milestone and age of diagnosis. The first type of SMA, type 0, is called congenital SMA, and it occurs with the prenatal onset of the neurodegenerative disease. Type 0 patients typically have a lifespan of fewer than 6 weeks and don't really achieve any motor milestones. The next type is type 1 spinal muscular atrophy, otherwise known as Wernicke-Hoffman's disease. And babies begin to show symptoms at less than 6 months of age and typically survive up to 8 to 10 months. And the highest physical milestone reached by type 1 patients is head control and the ability to sit up with support. The third type of spinal muscular atrophy is type 2 SMA, which affects children from ages 6 to 18 months. And most patients survive well into their adolescence, with over 70% of type 2 patients living at 25 years old. And these patients can sit independently when placed, however, experience developmental delay and loss of motor skills. Then there is type 3 spinal muscular atrophy, which is the mildest phenotype of spinal muscular atrophy, and patients are typically diagnosed after 18 months of age and usually reach the highest milestone of independent motor skills. Finally, type 4 SMA is incredibly rare and has an onset after 21 years of age, and patients typically have a normal lifespan. However, as the disease progresses, there's increased fatigue and proximal muscle weakness experienced by the patients. However, what really causes SMA and these different phenotypes is the genetic basis of the disease. Survival motor neuron gene 1 is essential for motor neuron growth. Humans, however, also have a second gene that produces this SMN protein called SMN2, which is basically a second copy of the SMN1 gene. However, what SMN2 lacks is a specific exon called exon 7, which is removed in the splicing of the gene. And because of this missing exon, the SMN2 protein produced by SMN2 is much less stable than the protein produced by SMN1. Therefore, a lack of functional SMN1 gene is a direct cause of SMA. However, the amount of protein produced by SMN2 is inversely correlated with the severity of the SMA symptoms. And the SMN protein has many functions in the body, including spliceosome assembly, mRNA trafficking and translation, and has cytoskeletal effects. So to begin with, one of the most important functions of the SMN protein is its role in creating a functional spliceosome. The SMN protein is associated with the macromolecular SMN complex, which ensures specificity during the snRNP assembly. And a mutated SMN basically causes the abnormal accumulation of these snRNPs, which correlate with disease severity. And deficiency in the SMN protein disrupts the formation of the minor snRNPs in charge of removal of certain intron genes. And a non-functional spliceosome means that important genes don't get spliced properly, leading to a larger effect on neuronal genes. The SMN protein also has an effect on mRNA trafficking in neurons due to the localization of SMN in dendrites and axons of motor neurons. The purpose of mRNA trafficking is in neuronal growth, which leads to faster protein production. The COP1 system is a Golgi-derived transport system involved in intracellular trafficking in the neuron, which promotes growth of neurons when SMN binds to the specific alpha COP units. And a mutated SMN would alter the alpha COP binding and disrupt SMN localization with growth cones, resulting in reduced neurite formation. Finally, one of the biggest impacts of a mutated SMN gene is its impact on cytoskeletal structure of a neuron. The SMN protein is in charge of modulating the localization of beta-actin through profilin 2A. Profilin 2A is an actin-binding protein expressed in the nervous system and is involved in the regulation of actin turnover, especially during neurite cell extension. Growth cone formation and neurite expression are regulated by actin, especially when exon segments 4 through 6 of the SMN gene bind to profilin 2A. And profilin leads to cytoskeletal rearrangement, helping neurons function. Therefore, a lack of it can affect cytoskeleton structure of the protein and cause cell death. So as you can see, disruption of ribonucleoprotein assembly, mRNA trafficking, and effects on neuronal cytoskeleton structure due to mutation of the SMN1 gene are big causes for neuron death in SMA. However, SMN is also involved in many different pathways as well, which I will not be going into, but just to put out there, it has a lot of effects. However, there's been a lot of discussion for potential treatments of spinal muscular atrophy. Most patients are treated by symptom management, including therapies and rehabilitation to prevent muscle weakness and death. However, gene therapy has been heavily researched as a potential cure for spinal muscular atrophy. The first option is a drug called Spinraza, which is a drug used to treat SMA patients by the increased production of the SMN protein, which are important, as I mentioned before, to the growth and maintenance of motor neurons. It works by rebinding exon 7 to SMN2 and making the protein produced by the SMN2 function similar to the protein produced by SMN1. Another drug being used is called Zolgensma, which uses a virus to deliver a functional SMN gene to the targeted motor neurons. And Zolgensma functions by replacing the SMN1 gene for the patient, which will send a copy of the SMN gene to a specific group of motor neuron cells, which will protect motor neuron and cell growth. So all in all, spinal muscular atrophy affects thousands of people around the world whose ages range from infants to fully grown adults and needs to be investigated further. In conclusion, I discussed how spinal muscular atrophy is an autosomal recessive disorder that causes progressive motor neuron death and is caused by a lack of the survival motor neuron gene, which is essential for motor neuron growth. The lack of SMN has multiple effects on patients, including ribonucleoprotein assembly, and has many effects in the cytoskeleton, which causes cell death. Many gene therapies have been developed to treat SMA. Thank you so much for listening, and especially a big thank you for my Polygens mentor, Olivia, and Polygens for throwing this wonderful event.
Thank you for the great presentation, Neetika. Now, let's continue with Rhea's presentation.
Can everyone see this?
Yes.
Okay, perfect. All right, so hi, my name's Rhea Acholkar. I'm a junior at CDHS High School. And yeah, so my research question was, how can the human race begin life on another planet outside of our solar system? So some background information, climate change. It's been kind of ruining the state of our Earth, so we might need to look into creating life on another planet. So Kepler 452b was discovered to possess the qualities to host human life. Traveling there can be made possible with using methods like the Hohmann transfer and future advances in space travel. So how did I conduct this project? I mainly used articles like NASA's articles on basics of spaceflight and rocket propulsion, and NASA's exoplanet catalog on Kepler 452b, and NASA's article on Kepler 452b called NASA's Kepler mission discovers bigger and older cousin to Earth. So what is an exoplanet? So over here, I have a little image that explains the different exoplanet types. Here we have Neptune-like, super Earth, and terrestrial and gas giants. So what is an exoplanet? And it's basically like an alien planet or planets that are located outside of our solar system, which are also known as extrasolar planets. So it's unclear whether or not these planets were created before or after a pulsar, which is a dead remnant of a star that has exploded. So we have 5 methods of detecting an exoplanet. So we have radial velocity, direct imaging, transit, astrometry, and gravitational microlensing. So radial velocity is basically when a planet causes a star to wobble, and direct imaging is when the glare of stars is blocked in order to see objects nearby. And then we have transit, which is actually the best way to discover a planet, and it's by observing when planets pass between its star and Earth. And then we have astrometry, when you take pictures of wavelengths to observe a star's movement in relation to nearby stars, and gravitational microlensing, which is the light of a star being bent by a planet's gravitational pull. So before choosing Kepler 452b as the planet that would be most suitable for a second Earth, I had to research multiple other planets. So 2 of the other main ones that I did was Kepler 186f and TRAPPIST-1, which is a solar system. So Kepler 186f is located 500 light years away from Earth, and it's in the constellation Cygnus, and its eccentricity is very close to 0. So there's no chance, it's pretty unlikely that there are temperature changes there. And TRAPPIST-1 was actually what I would have gone with, and it's located 40 light years away, and it contains 7 planets that are all Earth-sized, but only 3 are located in the habitable zone, which is kind of like the area around a star in which water can form. And most of the planets are actually too far from their sun to allow water to be formed, and we also don't know much about the 3 planets that are located in the habitable zone. So I did not go with that one. So in the end, I went with Kepler 452b because it's considered by NASA to be the closest analog to our Earth and our sun. And it has a rocky surface, and it's within the habitable zone of a G-type star, which is the same type of star that we have, our sun. So some information on Kepler-452b. It's the same temperature as Earth. Its diameter is 10% larger than Earth, and it's located in the constellation Cygnus. It has spent at least 6 billion years in the habitable zone of its star, so there is a very good chance that there is life on this planet. So it's also the Kepler-452 system is located 1,400 light years away, and its host star is called KIC 8311864. Its orbit around its star takes about 384.84 days, and our sun and KIC 8311864 are similar in mass and temperature, which is a very good sign because we would need, a lot of scientists have found that like having a similar star would mean that it would be closer to Earth. So rocket engines. Usually rocket engines consist to combustion chamber and nozzle and the injector. So the nozzle converts chemical and thermal energy in the chamber into kinetic energy, which allows for higher velocity. The conical nozzle is mostly used in early rocket designs, and the bell nozzle is used for higher performance and shorter length, and it employs a fast expansion section. And the combustion chamber is mainly used with 3 different geometrical shapes like spherical, near spherical, and cylindrical, which is the most used in the US. And the image over here represents what a standard rocket engine would look like. So overall, a rocket with a bell nozzle and a cylindrical combustion chamber should be used for a spacecraft when launching off of Earth on its way to Kepler-452b. So traveling at the speed of light. So in order to successfully travel to Kepler-452b in light years, there would need to be some future innovation that allows humans and the spaceship to survive the journey while traveling at the speed of light, because both the human and the spaceship would likely disintegrate. So there would need to be some future innovations in our space travel technology. So the Hohmann transfer, it's basically an orbital maneuver that transfers a satellite or a spacecraft between circular orbits. So the Hohmann transfer consists of 2 circular orbits and 1 elliptical orbit, and it's the most fuel efficient way to move a spacecraft through space. So basically, a spacecraft enters the outer orbit and it speeds up as it moves closer towards the inner ring and the smallest orbit of the planet. So as it moves in, it gains momentum. And by gaining this momentum, it eventually can launch itself away from and outside of our solar system. So I chose Jupiter as a planet to do this with, to use the Hohmann transfer on, because the bigger the mass, the more propulsion you would get on your spaceship. So in conclusion, it can be concluded that Kepler-452b could possibly be a habitable planet for humanity. And the journey there can be made possible using the Hohmann transfer and a rocket with a bell nozzle and cylindrical combustion chamber. We would definitely need to improve our rocket technology to allow us to travel at the speed of light without us disintegrating or the spaceship being exploded. So Kepler-452b could potentially end up being a second Earth for the human race. Thank you so much. I want to thank Polygens for giving me the chance to research this, and my mentor, Sophia, for helping me and guiding me through this project. And let me know if you have any questions.
Thank you for this mind-blowing presentation, Rhea. Our next presenter will be Vincent. So Vincent, if you're ready.
Yes.
Let's jump in.
Wait. It's not letting me. It's not letting me share my screen.
Let me look into it.
Yeah.
Are you able to share your screen now?
It says I can only share my screen if I leave and join back. Can I leave and join back really quick?
Yes, we'll wait.
Okay.
We'll wait for you.
Thank you.
Of course. until we are waiting for Vincent to join us again, I'd like to highlight that after Vincent's session, we will have a Q&A, a brief Q&A, where all 5 of our presenters can answer audience questions.
Okay.
Hi, Vincent.
Okay, I can share my screen now. Okay.
Amazing. If you're ready, let's.
Okay. Teeth are essential to our bodies. They play big roles in actions such as chewing, digesting, and even talking. But diseases such as tooth decay have prevented many from using their teeth in those simple actions. They prompt patients to choose between different methods of treatment, which I aimed to research. Hello, my name is Vincent Nguyen, and today I'll be presenting my project on comparison of root canal versus dental implant, outcome and success rates. So the question I wanted to answer was, in adult patients with a detrimental cavity or infection, does treating the tooth with the root canal lead to higher success and better result over placing an implant? So what is tooth decay? Tooth decay is a disease that negatively affects over 92% of adults aged 20 through 60. It causes pain, discomfort, and is very dangerous if left untreated. So the anatomy of the tooth. The tooth is made up of the enamel, the dentin, and the pulp. The enamel is the outermost part of the tooth that protects the insides of the tooth from forces such as chewing. The dentin is the second layer of the tooth, where it is a dense tissue and makes much of the tooth's mass.
Vincent, sorry to interrupt.
Yeah.
Your slides seem to still load. So I just wanted to make sure that maybe if you try sharing them again, then it would load correctly.
Let me.
Take your time.
I'm sorry.
No problem. Right now, I see a white screen.
I'm not sure. It says your screen sharing is being paused, but I'm not sure why.
Let's maybe try stop sharing your screen and then share again.
Okay. Can you see it now?
I can see your screen now.
Okay.
I can see.
Can you see this?
Perfect. Now we can. If you're more comfortable, you can start from the beginning, whichever way you're more comfortable with.
I'm just gonna start from the beginning. Sorry about that.
Absolutely no problem.
Okay. So teeth are essential to our bodies. They play big roles in actions such as chewing, digesting, and even talking. But diseases such as tooth decay have prevented many from using their teeth in those simple actions. They prompt patients to choose from different methods of treatment, which I aimed to research. Hello, my name is Vincent Nguyen, and welcome to my presentation on comparison of root canal versus dental implant, outcome and success rates. So the question I wanted to answer was, in adult patients with a detrimental cavity or infection, does treating the tooth with the root canal lead to higher success and better result over placing an implant? So what is tooth decay? Tooth decay is a disease, also known as cavity, that negatively affects the oral health of over 92% of adults aged 20 through 60. It causes pain, discomfort, and is very dangerous if left untreated. So, the tooth is made up of the enamel, the dentin, and the pulp. The enamel is the outermost part of the tooth that protects the insides from forces such as chewing. The second layer, which is the dentin, is a dense tissue that makes much of the tooth's mass. Finally, the pulp is the last layer, which holds nerves, blood cells, and various blood vessels and various cells that function for the nutrition and protection of the tooth through immune response. So, if the cavity reaches the pulp, then either a root canal treatment or a dental implant is needed. For root canal treatment, the endodontist will first apply anesthesia to the inferior alveolar nerve, which is right here. It anesthetizes other nerves as well as parts of the mouth, including parts of the tongue and also the floor of the mouth. Next, the endodontist will pour sodium hypochlorite into the root canal chamber, which will kill all unnecessary substances. Then, using specific instrumentation, the root canal is shaped and cleaned. After that, gutta percha is used. Gutta percha is a substance from a specific type of tree. It seals the root canal, and then after that, a proper restoration or a filling is needed. A proper restoration is a crown. So for dental implants, first, the patient is put under conscious sedation and their entire mouth is put with anesthesia. After that, the surgeon will they will open the gum, which will reveal the bone. After they reveal the bone, they will make a hole into the bone where the implant will fit. After the implant is screwed into the bone, it will take many months for it to heal. This process is called osseointegration, where the implant connects with bone and tissue for many months. After this healing period, a finalized abutment and crown is needed to finish the implant procedure. So instead of restoring the tooth, dental implants replace the roots of the teeth. So for success and failure rates, for root canal treatment, these were 3 different studies, and there were very high success rates. One study concluded that there was a 97% of the teeth retained in a study of 1.4 million patients over 8 years. In this study, they also measured the functionality, and it was reserved at 95%. Lastly, another study guided it into a strict and loose criteria. A strict criteria would be the apical lesion, which is the part where it is infected, to be fully restored. And the loose criteria would be where it was mostly restored. The strict criteria success rate was 75% from 40 studies, and the loose criteria success rate was 85% from 36 different studies. For dental implants, they were very similar. I took an average from 4 studies, and it was a 91%. Unlike the root canal treatment, these studies evaluated them for 10, 16 plus years. This success rate shows the longevity and the sustainability of dental implants and their ability to survive through aging. For factors for success, so root canal treatment included smoking, the dental provider, and inadequate instrumentation. Although these were factors, they were not as significant as retreatment, and I will go into retreatment, but they still were minor changes because they were pretty rare. For dental implants, smoking, alcohol, and diseases were also factors, but they were clear factors, and there was clear success, and there were reasons for failure. But sinus augmentation and immediate loading, which I'll go into the following slides, were very confusing because all the results were fluctuating. For retreatment, the study divided the group into the RCMR group and the RCMA group, where these definitions would fall under each group. The RCMR group had a success rate of 83%, but the RCMA group only had a success rate of 48%. This was very significant as it hinted towards that the RCMR group, their conditions were favored. But what is really important is that this proves that previous endodontic treatment will affect retreatment. Also, the retreatment process is very similar to that of the original root canal treatment. For sinus augmentation and immediate loading for implants, sinus augmentation is needed when there's not enough bone and the implant cannot be placed. The surgeon will reveal the sinus by cutting through the membrane and adding autogenous bone grafts, which are bone grafts from other parts of the body where they are unnecessary. After that, it takes a very long time to heal, about 6 months. The full procedure with the sinus augmentation will even take maybe up to a year, because after they screw the implant in, the osseointegration will occur. So the problems with sinus augmentation include the development of sinusitis, which causes delayed healing in inflammatory regions, and also the efficiency for the patient, which will cost a lot of time. To counteract this, short implants were made, but there was no clear definitive result for the short implants as their success rates fluctuated. For immediate and conventional loading, conventional would be the osseointegration discussed before, where it would take months to heal. But immediate would be finalizing the treatment 48 hours after it's screwed in. It reduced the treatment duration by a lot and can be done in one visit. Although it seems very pleasurable, there were many articles debating on which one was better. One would say that conventional was better, and another would say that immediate was better. But the success rates in those articles were very high, and there was only a 2% differential margin in success rates. It shows how both are workable, but patients still need to be informed of all their options. So for postoperative pain and efficiency, both treatments had very little pain. It decreased by the hour and by the day. But for implants, the amount of modification, which is sinus augmentation, before adds pain. And also for root canal treatment, there was a report that women experience more pain because of their different hormone levels. For efficiency, implants failed to copy the function of the periodontal ligament, which helped with chewing and bite force. Root canal treatment, though, copied it and was very successful. Also, the cost in economic comparison was very big. Implants costed twice as much as those of root canal treatment. So in conclusion, both treatments are viable, but root canal treatment should be the first solution proposed unless there's a situation in which a tooth is too infected and it's too much for the root canal to handle, then a dental implant should be used. I want to thank Polygens and my mentor, and thank you for listening. I'm open for questions now.
Amazing. Thank you for that great presentation, Vincent. Now let's continue with the Q&A session. I would like to ask all 5 of you to turn on your videos and mics. First, we have a question to Angel. Is there a specific species you'd most want to communicate with, and a species you think would be most beneficial for us to communicate with?
That's a great question. I don't actually know if there is a specific species that would be the most beneficial, because different animals, they're adapted to their specific environment, and it's varies based on the situation. For example, if it was during an earthquake and after an earthquake, there are a lot of human remains that needs to be found, then an animal that's smaller in size, such as mice or beetles, if humans can communicate and cooperate with them, it would be easier for them to find human remains than using dogs, for example. However, there's also certain animals that it's easier for humans to communicate to than others. For example, gorillas, bonobos, they're shown to use sign language to communicate with humans, and also parrots and certain birds, they can imitate human sounds and also produce them and understand human language. So it depends on physical traits of the animals as well. And other things, just it's kind of similar to who someone wants to be a friend to, I guess. It just depends on which human and their needs. Yeah. I hope that answers it.
Yes, thank you. That was a great answer. Now let's continue with Rishabh. Rishabh, I'd like to ask, you had a very interesting presentation, and I'd like to ask, what next question would you pose to the field to continue your investigation on cannabinoids and epilepsy treatment?
Yeah, so that's a very good question. One of the biggest problems in that field right now is the lack of studies conducted in adult modes. So like I said, when you look at the breakdown of epilepsy, 3 million adults in the US alone have epilepsy, around like 400,000, closer to 500,000 children have epilepsy. But there's really only clinical trials that have been performed in pediatric studies. So not much data is really present for adults. So my research question was looking for adults, but we actually had to like shift our approach because there really wasn't like very many studies that actually talked about solely adults. So we had to do trials that included both pediatric and adults. And like I said, the FDA also passed, I'm pretty sure the AD called Epidiolex as a valid form of treatment for people who are like older than 2 months, but nothing has been passed so far for adults because there's really just not enough research done. So there definitely needs to be more pushes in that field towards like adult modes.
Thank you. Thank you. Yeah. Now let's continue with Neetika. Neetika, I'd like to ask, what would be next steps for you now that you've completed your project on spinal muscular atrophy? Will you continue to build up on this? What are your next steps?
Yeah, thank you so much for this question. So I don't know if I mentioned this before, but I've always been interested in just studying like neuron degeneration. Like last summer, I studied multiple sclerosis, which is, as I mentioned in my presentation, another type of neurodegenerative disease. And this summer, I decided to expand my knowledge and to study spinal muscular atrophy. So it really depends on my next research project if I want to pick a new neurodegenerative disease or continue with spinal muscular atrophy. I think I might pick a new one just because, or like just to expand my knowledge and learn more about neurodegeneration, which is kind of like my passion. But yeah, thank you so much for this question. I
love that you're continuing with your passion, but keeping it open and exploring multiple smaller topics within that. Amazing. I would also like to pose a question to Rhea. Rhea, you had a mind-blowing topic with choosing this exoplanet, and I'd like to ask, what was the most unexpected thing you learned during your project?
So during my research, I actually found that there were at least 10 billion exoplanets like located in outer space. There are like millions of galaxies, and I was like very, very confused on how to figure out which exoplanet would be the best and which would be like most suited for like us to use as a second Earth. So yeah, I was really shocked to find out how many different planets there are, and that there's like a very good possibility that there is another planet that is basically like a second Earth with maybe even like humans or extraterrestrial life living there. So yeah, that was pretty mind-blowing for me.
Yes, I agree. Thank you for your answer.
Yeah.
And Vincent, I'm very happy that we could see your slides because they were amazing, just as your presentation. And I would like to ask, first of all, what drew you to research this topic?
Okay, that's a great question. So a few years ago, I wrote my first paper on cavities in general, because my parents have always pushed me into this this topic, but I wanted to further my research because when I look back at that cavities paper, I realized it wasn't as good as it could have been. So my my cousin introduced me to polygens, and at first I was having trouble finding a new topic, but I eventually found it and I learned so much, and now I really want to write more. Like yesterday I even started on a new project, but it was for myself, not with polygens, on how malnutrition leads to edentalism, which is the loss of teeth. So yeah.
Great to hear that you, after your earlier research, you dug deeper into this, and that's how this project came to life.
Yeah.
Great. So we are a little bit over time, so I think it's time to wrap up. First of all, I would like to congratulate all 5 of you. You did an amazing job today, and your presentations were truly engaging and exciting. Thank you for your attendance and your participation today. And I would like to encourage everyone to, we have many more interesting upcoming sessions. So if you're interested, you can check them out. And we also have a panel discussion coming up on showcasing your research in college applications. So if you're interested, feel free to check that out. Thank you again for your presentations and attendance today, and have a great day, everyone.
Thank you.
Thank you.
Thank you.
Thank you.
Bye.